You mentioned the spinal cord. So I know that you work a lot in the field of spinal cord injury. What role does ECM play in this topic?
Again, there are two different, I need to separate them into two different situations. One is the loose extracellular matrix and one is the perineuronal nets again. So after spinal cord injury, I think in the last 20, 25 years, it's very obvious, it has been established very well that the glial scar that is formed around the lesion site, that is, these are activated astrocytes basically coming to the lesion area, trying to fence off the injured site in the spinal cord. And they are upregulating chondroitin sulfate proteoglycan, which is one of the extracellular matrix molecule. And then removing these extracellular matrix molecules around the lesion site allows the neurons to regrow at least across the lesion site. And it has been demonstrated in many animal models, and I think there are probably some clinical trials going on that side. At least there are two, at least in the phase 1 clinical trial right now, are targeting these glycan structures and see whether they can enhance regeneration across the lesion to enhance regeneration. That's one. But at the same time, anything that is removing these extracellular matrix molecules around the lesion site will also affect the perineuronal net in the surrounding. And as I said earlier, so perineuronal net is modulating synaptic connection. If you remove the perineuronal net passively, not intentional, but passively due to the other strategy, then you will also open up the neurons in the surrounding area, allowing them to make more synapses. And in the spinal cord, at least a lot of the neurons wrapped with perineuronal nets are interneurons. So you can imagine that there will be quite a lot of sprouting and rewiring and reorganization of circuitry actually happen in and around the lesion site using these strategies. So when we are designing tools to remove these molecules, we are basically enhancing two procedures. One is regeneration. The other one is enhancing plasticity. So by going through these two processes, then we do see quite significant functional recovery in animals afterwards, at least in locomotor function, because that is what we are focusing in the spinal cord injury. There are also people looking at other functions such as bladder functions and other sensory functions, but at least in our hands, in terms of locomotor function, they do recover quite significantly.